Between 2 to 3 million sports-related concussions happen every year. It happens when the head and brain move rapidly back and forth and strike the inside of the skull. Now, the injuries are complex. They're often misunderstood. News4JAX reporter Vic Micolucci looks at some of the common myths.
Concussions are a hot topic in the world of sports. And while you may have heard a lot about these injuries lately, there's also a lot of misinformation out there. Our first myth: a concussion always involves a direct hit to the head. In fact, whiplash or a jolt to the body that shakes the head can also cause a concussion. Another popular myth:
some people still say it's a bruise on the brain. We know it's not that. A concussion is basically normal imaging, so there's no signs of bruising at all.
You may have heard that you shouldn't sleep after a concussion, but that is also not true. The University of Michigan Health says sleep can actually be beneficial. Another fallacy: you have to lose consciousness to have a concussion. Only about 10% of concussions involve a loss of consciousness. And should you always go to the ER if you have a concussion? The answer is not necessarily. If you have mild symptoms, you can be cared for at home and follow up with a doctor within a few days. Our last myth: you can return to sports as soon as you feel okay.
And a lot of people think that you should, quote, fight through a concussion. Well, we know that these days that can be very dangerous and that can lead to severe traumatic brain injury.
The rule of thumb: you shouldn't return to play until you've been cleared by a medical professional. With concussion myths you need to know, I'm Vic Micolucci reporting.
Some common signs of concussion include headache, nausea, sensitivity to light or sound, dizziness, sleep problems, confusion, and also mood changes.